The following portion of Daytime is sponsored by Florida Cancer Specialists and Research Institute.
Men's Health Month is a good reminder of the health issues that men face and the screenings recommended by their doctors. With more attention on prostate cancer in recent years, our next guest is here to talk about the risks and share the latest advancements in prostate cancer care. We now welcome Dr. Bradford Perez, radiation oncologist with Florida Cancer Specialists and Research Institute. Dr. Perez, welcome.
Thanks for having me.
It's nice to have you. So how common is prostate cancer in this country and who's most at risk?
Yeah, so prostate cancer is a very common malignancy. In fact, among men, aside from non-melanoma skin cancers, it's the most common skin cancer. And over 300,000 men are diagnosed with prostate cancer each year in the United States. Prostate cancer can be a very treatable cancer if it's diagnosed early, but even now it claims almost 35,000 lives each year.
Wow. So if a man is diagnosed with cancer, what are his treatment options, specifically prostate cancer?
Sure. So yeah, most of the time, men who are diagnosed with prostate cancer find themselves with an elevated PSA test. And so a PSA test is a great screening test to initially identify patients who may have prostate cancer and who may be in need of further workup. Typically, the workup is coordinated by a urologist who performs a biopsy, and once a biopsy has been made, we will then go on to consider and make treatment recommendations. And I always recommend that for patients who have a diagnosis of prostate cancer, that it's important for them to meet with an oncologist to talk about treatment options.
Are there warning signs of prostate cancer?
Yeah, so there can be, and prior to the advent of the PSA test, many men's prostate cancers were detected at more advanced stages. And some of the symptoms that are common for prostate cancer in the more advanced stages can be urinary symptoms or sometimes increased difficulty with passing urine or burning with urination. So these can sometimes be symptoms of prostate cancer. Also, in most advanced cases, bone pain can be a sign of metastatic prostate cancer.
How successful are prostate cancer treatments generally?
So when prostate cancer is detected early, some men may not need any treatment, and active surveillance can be a great option for those patients. For men with low risk or early stage prostate cancer, the survival rates can be as high as 99%. So when prostate cancer is detected early, the outcomes are really good. Even for men with intermediate risk prostate cancer, survival at 10 years can be as high as 95%. For men with high risk or metastatic prostate cancer, the outcomes are not as good, and we're continuing to look for better treatment options for these patients with the highest risk of cancer progression. In
the last 20 seconds, would you share one of the most promising treatments that you're excited about?
Sure. So I think in prostate cancer, one of the areas where we're making significant strides is in radiation therapy treatments, which can be more for patients with early stage cancer, where we can deliver treatment in just 5 days, and also for patients with more advanced cancers, we sometimes need to deliver the treatment over a longer course of treatment.
All right, doctor, thank you very much.
Yeah, thank you.
If you'd like more information, visit flcancer.com/prostate cancer. Daytime, we'll be right back.
The preceding portion of Daytime was sponsored by Florida Cancer Specialists and Research Institute.